Hello, everyone, and welcome to today's deep dive into inflammatory bowel disease, or IBD. Whether you're here because you're personally affected, a caregiver, a healthcare professional, or simply curious, you're in the right place. IBD is a chronic condition that impacts millions of people worldwide, and understanding it is crucial for managing and improving the lives of those affected. Now, we're going to explore the various aspects of IBD, including its types, symptoms, causes, diagnosis, treatment, and how people live with the condition. Let's get started. In simple terms, inflammatory bowel disease refers to a group of inflammatory conditions affecting the digestive tract. It's often confused with irritable bowel syndrome, IBS, but IBD is a much more serious condition that causes chronic inflammation in the bowel. IBD includes two primary conditions, Crohn's disease and ulcerative colitis. These diseases cause inflammation, irritation, and damage to the lining of the digestive tract, leading to a variety of symptoms and complications. Now that we have a general understanding of what IBD is, let's break down the two main types, Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the digestive tract from the mouth all the way to the anus. It tends to involve deeper layers of the intestinal walls and causes sections of the bowel to become inflamed, leading to thickening of the intestinal wall. Symptoms of Crohn's include abdominal pain, diarrhea, weight loss, fatigue, and sometimes complications outside the intestines, like skin rashes and joint pain. It often appears in patches, meaning healthy sections of the intestines are surrounded by areas of inflammation. Ulcerative colitis, on the other hand, is limited to the colon, large intestine, and rectum. It usually begins in the rectum and spreads upward, affecting the innermost lining of the colon. Common symptoms include bloody diarrhea, abdominal cramps, and an urgent need to use the bathroom. Unlike Crohn's, ulcerative colitis typically involves continuous inflammation in a specific area rather than patchy areas of inflammation. Both Crohn's disease and ulcerative colitis cause inflammation, but they affect different parts of the digestive system and have some distinct symptoms and complications. Now let's dive into the causes and risk factors associated with IBD. While we don't know the exact cause of IBD, several factors seem to contribute to its development. Genetics play a significant role. People with a family history of IBD are more likely to develop the condition themselves. Specific genes related to the immune system may make some individuals more susceptible to inflammation in the gut. IBD is considered an autoimmune disorder. The immune system mistakenly attacks the intestines, causing inflammation and damage. Normally, the immune system protects the body from infections, but in IBD it misidentifies harmless substances or bacteria in the gut as threats. Environmental triggers like diet, stress, smoking, and even infections have been linked to the development of IBD. Smoking, for example, is a known risk factor for Crohn's disease, though it appears to be protective against ulcerative colitis. Diet may also play a role, with some studies suggesting that a diet high in processed foods could increase the risk of developing IBD. IBD often develops between the ages of 15 and 30, but can occur at any age. People of Ashkenazi Jewish descent have a higher risk of IBD, particularly Crohn's disease. While the exact cause remains unclear, IBD is thought to result from a complex interplay between genetic predisposition, immune system dysfunction, and environmental factors. Understanding the symptoms of IBD is crucial for early diagnosis and management. Symptoms can vary from mild to severe, and they can also come and go. Gastrointestinal symptoms, diarrhea, sometimes with blood or mucus, abdominal pain and cramping. Urgency to use the bathroom, unexplained weight loss, fatigue, extraintestinal symptoms. In addition to gut-related symptoms, IBD can cause symptoms outside of the digestive system, such as joint pain or arthritis, skin rashes, eye inflammation, liver problems, kidney stones. IBD symptoms often occur in flare-ups, where symptoms worsen over time, followed by periods of remission where symptoms improve or go away entirely. IBD symptoms are diverse, and it's important to be aware of both gastrointestinal and extraintestinal signs. They can range from mild discomfort to severe life-impacting issues. Diagnosing IBD can be challenging because its symptoms overlap with other gastrointestinal conditions. However, a series of tests and evaluations help healthcare providers confirm the diagnosis. A healthcare provider will take a detailed medical history, including family history, lifestyle, and symptom patterns. They will also conduct a physical exam. Blood tests can help identify signs of inflammation and anemia, as well as check for infections or other conditions that could mimic IBD. Stool tests are used to rule out infections or parasites that may cause similar symptoms to IBD. Imaging, like CT scans or MRIs, may be used to get a clear picture of the bowel and to identify complications such as strictures or abscesses. An endoscopy, for the colon or small intestine, allows doctors to look directly at the affected areas and take tissue samples, biopsies, to confirm IBD and distinguish between Crohn's disease and ulcerative colitis. Getting a definitive diagnosis of IBD involves multiple tests, but a combination of physical exams, imaging, and endoscopic evaluations can provide clarity. Now that we understand what IBD is and how it's diagnosed, let's talk about the treatment and management options available for people living with IBD. Medications, anti-inflammatory drugs. Medications like aminosalicylates, 5-ASAs, are commonly used for ulcerative colitis to reduce inflammation. Immunosuppressive drugs. For Crohn's disease and more severe cases of ulcerative colitis, medications like corticosteroids, azathioprine, and methotrexate help suppress the immune response. Biologics such as TNF inhibitors, for example, infliximab, are increasingly used to treat moderate to severe IBD by targeting specific parts of the immune system, diet, and lifestyle. While there's no specific diet for IBD, maintaining a balanced, nutritious diet is important. Some people find relief by avoiding certain foods like dairy, high-fat meals, or high-fiber foods during flare-ups. Drinking plenty of water and managing stress are also critical components of managing the disease. Surgical treatment. In cases where medication doesn't work or complications arise, surgery may be needed. In Crohn's disease, surgery is often used to remove damaged parts of the intestines, while in ulcerative colitis, a colectomy, removal of the colon, may be necessary. Now, living with IBD is not just about medical treatments, it's about thriving despite the challenges. Here's how you can manage IBD in your daily life. Here are a few tips to live well with IBD. Know your triggers, track foods and stressors that trigger flare-ups. Stick to your treatment plan. Stay consistent with medications and follow-up care. Adopt a healthy diet. Eat nutrient-rich foods. Consider low-residue or low FODMAP diets if needed. Manage stress. Practice relaxation techniques like yoga, meditation, and mindfulness. Join a support group. Connecting with others who understand can make a world of difference. Though there's no cure for IBD, treatment options are available to manage symptoms, induce remission, and improve quality of life. Medications, lifestyle changes, and in some cases surgery can help individuals manage the disease. Thank you so much for joining me in this comprehensive overview of inflammatory bowel disease. I hope you now have a better understanding of IBD, its causes, symptoms, and the ways it can be managed. Remember, if you or someone you know is dealing with IBD, it's important to work closely with healthcare providers to develop a treatment plan that works for you. Don't forget to like, share, and subscribe to this channel for more health-related content. If you have any questions or want to share your experiences, please leave a comment below. Take care and stay healthy.